Only 10% of patients who come in with chest pain actually have a heart attack or blocked coronary arteries as the cause. One of the questions we often face in the clinic or office is from patients who come in with chest pain and insist that their pain is due to blocked coronary arteries. It's true that the most important sign of a heart attack or blocked coronary arteries is chest pain, but not every pain indicates a heart problem. In other words, not everything that looks like a walnut is actually a walnut. The reason is that besides the heart, there are other organs in the chest that can also cause pain. So what other diseases can present themselves with chest pain? If we move from the surface of the chest inward, the first layer is the skin. Diseases that affect the skin, especially skin infections, and most commonly shingles. In these cases, the chest can be very painful, so much so that even when they put on their clothes or they say, "Doctor, even when my hand touches my chest, I feel intense pain." In people who exercise, especially a young person who goes to the gym, lifts dumbbells, works out, or does bench presses, when they come home at night because of the strain on these muscles, they experience pain. The next part is the bones of the chest wall. These can become inflamed or injured, like patients who have costochondritis. The next organ is the digestive system. Various parts of the digestive system can be sources of pain, such as a patient who has gallstones or inflammation of the gallbladder wall, or someone whose pancreas is infected and inflamed. Patients who have stomach ulcers or intestinal ulcers, these can also present as burning and pain in the chest. The next organ in the chest is the lungs. Lung involvement and infection can lead to pain, and sometimes the abnormal accumulation of air in the lung space, which we call pneumothorax, can also cause pain. This too should be distinguished from cardiac causes. And finally, the heart itself. The heart itself can be the source of pain, but not every pain is due to a heart attack. Sometimes the membrane around the heart may become inflamed, and in that case, it can cause pain. Or sometimes cardiac pain is caused by valve stenosis, such as aortic valve stenosis, or by involvement of the major coronary arteries, such as the aorta or the pulmonary artery. If the pulmonary valve or the pulmonary artery becomes embolized and a blood clot gets lodged there, it can cause cardiac pain. So the good news is that when you experience heart pain, it doesn't necessarily mean you're having a heart attack. There could be other causes as well. But since a heart attack is the most important and life-threatening among all these, we first think about the heart and need to rule out cardiac causes. Once we're sure it's not a heart attack or a blockage in the heart vessels, then we can move on to other causes such as gastrointestinal, skin, muscular, or skeletal issues.